Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Moderate sedation. Introduction. You may have been scheduled to have a procedure under moderate sedation. This program will help explain the benefits and risks of moderate sedation. Procedure. To prevent you from feeling pain during your procedure, your healthcare provider may provide you with moderate sedation. Moderate sedation is different from general anesthesia. Your healthcare provider will administer the medications that will sedate you. During the time you are under the effects of moderate sedation, your healthcare providers will watch over you and make sure your heart and lungs are functioning properly. Initially, an IV will be placed in your hand or arm to deliver the medications. You will then be given medications that will help you relax and reduce discomfort. You may feel sleepy and may not remember parts of the procedure, but you will be easily awakened when touched or spoken to. Throughout the procedure, your heart rate, heart rhythm, blood pressure, and oxygen concentration in your blood will be watched closely using medical instruments called monitors. It is common for you to receive oxygen when moderate sedation is given to you. After the procedure. After your procedure, you will be monitored and observed as the sedation wears off. This usually takes 30 to 90 minutes. Before being discharged, the healthcare providers will make sure that your vital signs are stable, you are able to walk without feeling dizzy, you are able to drink, and do not develop any nausea or vomiting. Usually, there are no significant after effects of moderate sedation, but your judgment, reaction time, and short-term memory may be impaired for up to the next 24 hours. Because of these effects, you cannot drive yourself home. You must bring a responsible adult to take you home. Do not operate dangerous machinery or equipment, drive, or make important decisions for at least 24 hours after sedation.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Risks and complications. Because of significant advances in technology and medications, moderate sedation is safe. But there are some possible risks and complications. You can do a lot to prevent them. You should make your healthcare provider aware of any medical problems that you may have, such as heart, lung, or kidney problems, strokes, and liver damage. Previous blood transfusions, diabetes, high blood pressure, the amount of alcohol you drink, jaundice, depression, and other psychiatric disorders should also be shared with your healthcare provider. You should also tell your healthcare provider about any previous experiences with sedation and anesthesia, including how you reacted to them. Tell the healthcare providers about any over-the-counter medications and herbal supplements you take. Medications you are taking could interact with the sedation medications. Tell your healthcare providers if you have any allergies to medications, foods, or latex. You may develop allergic reactions that are discovered during your procedure, such as allergies to tape, latex, and iodine-containing solutions. Rarely, nausea and vomiting could happen after moderate sedation. This is usually treated using anti-nausea medications. There is a risk that your breathing may slow down. If this happens, an oxygen mask may be put on your face. Sometimes a healthcare provider may put a tube in your air pipe or trachea to help you breathe. If this happens, your throat may be sore afterwards. When you are breathing better on your own, the tube is taken out. There is a risk that your blood pressure may drop when receiving moderate sedation. If this happens, your healthcare provider may reposition you or increase the infusion rate of your IV. There is a small risk of infections, strokes, cardiac arrhythmia, heart attacks, and possible death during moderate sedation. These risks are very small and more likely in older people and patients who have medical problems or a previous history of strokes or heart attacks. Your anesthesia specialist is prepared to treat reactions to medications used in the operating room. In spite of the best effort, in rare instances these reactions could be fatal. It is therefore very important to inform your anesthesia team of all your known allergies. Be sure to tell your anesthesia specialist if there is any chance you may be pregnant. Special precautions should be taken during the operation.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. To prevent you from feeling pain during your procedure, your healthcare provider may provide you with moderate sedation. Moderate sedation is different from general anesthesia. Your healthcare provider will administer medications that will sedate you. During the time you are under the effects of moderate sedation, your healthcare providers will watch over you and make sure your heart and lungs are functioning properly. Moderate sedation is very safe, but there are some possible risks and complications. Most of the complications can be prevented through good communication. Make sure to inform your healthcare providers of all your medical conditions, medications, allergies, and previous experience with sedation.
Thank you for using Explain.